Welcome to the discussion. My guests today are Tim Pados, the Vice President and General Manager of Government at IBM, JP Pollock, the founder and Chief Architect of the Commons Project, and Dr. Jay Schnitzer, the Vice President and Chief Technology Officer and Chief Medical Officer at MITRE. Gentlemen, welcome to the discussion. Just a little context for our conversation today. At a recent Defense Department sponsored conference, attendees had to prove they had been vaccinated. Maybe they pulled out a piece of cardboard from the CDC they received after getting vaccinated. Maybe they showed a photo of that card on their phone. The conference was among the first signs that there's some sense of normalcy coming back after more than a year of the pandemic. With more than 160 million Americans having received at least one dose of the COVID-19 vaccine, the broader question now must be asked, what steps do we as a society need to take to return to those pre-COVID times of concerts and movies, sporting events, and all those things that we enjoyed as part of a mass gathering, and we don't have to worry about a massive outbreak. One of those ideas is the use of vaccine credentials as a key to opening up society. The idea would be to create a privacy-preserving health status verification app that would be as easy as online banking. They must be digital first, but not digital only, to ensure all citizens have the wherewithal to take advantage of the vaccine credential. Technology companies and federal, state, and local governments must address common fears and concerns, real or perceived, about the vaccine credential, including those around privacy and security of medical data. Let me start with the basics. What is the vaccine credential? Discuss this concept, how it would work. Let me start with Tim, because IBM has been obviously part of the leading edge on this.
Well, thanks, Jason. First off, thanks for having me on. It's great to be here today. Honored to be joining this interview with my two distinguished colleagues, Jay and JP. We all sort of work in the same space and are focused on the same objective, which is how do we return to some sense of normalcy, get the economy open, and move forward. When you talk about the digital health credential, I think it's important to talk about what it's not first. You hear a lot out there about, vaccine passports and that sort of thing. It's not that, okay? All a digital health pass is an electronic equivalent of this, your CDC card. Now, this is great, and this is what I can use to verify my my vaccination, but there are some issues with it. One is it's paper, doesn't fit in my wallet, which means I'm going to stick it in my jeans, which means, being the klutz that I am, this is going to go through the wash sometime in the next couple of weeks. When I got vaccinated, I asked UConn Medical Center here in Connecticut, what do I do if I lose my card? They didn't know. They said, call the state. Where do I call the state? Okay, so getting that replaced is going to be a challenge. The second thing is that this can be, anyone good with PowerPoint can cook this up, counterfeit this within about 20 minutes. So all a digital health pass is an electronic version of your paper card. For instance, New York is using the New York Excelsior Pass. My daughter happens to go to school in New York City, and I have another daughter in Utica. So here's that pass. There's no personal identifiable information on it other than the name and the date of birth. It does not call back home when I go to verify it. It exists at the edge on my phone, and then someone can use that to verify. So it's voluntary. You don't have to use it. You can use the paper pass, or you can print off your digital health credential off of your phone or your laptop. It's secure. It's private. It secures privacy. And it's also interoperable. And really what it is about trust. You could say that in the last year or so, many residents have lost a little bit of trust or faith in their societal institutions in general, and government in particular. And just because the government says, okay, it's great, Tim, you can go out and get on a cruise, for instance, doesn't mean I'm going to be super eager to get on that ship unless I know that A, they're sanitizing and doing social distancing, and B, that they're taking reasonable precautions that the folks that are going to be joining me on that boat have either been tested or they've been immunized. And that's that's really about convenience and giving me a sense of level of trust and comfort that it's okay for me to leave my house and rejoin the economy.
Tim, you bring up some interesting points and I think it's a key thing to repeat. Not about PII, very simple. You own it on the edge of your phone. It's not in some central database that the government's going to collect. I think those are some of the fears as I've been doing research around this that has come up. How to ensure that this is not just going to be some massive database. And I think people are uneasy about that concept. And I think that's why a lot of times this idea of vaccine credentials, vaccine passports, whatever we're going to call them, has gotten maybe a little bit of a bad rap. Is that the message that you all have been trying to kind of get out of kind of what this is and what this isn't?
Absolutely. So, you know, the good news is that there are capabilities, technical capabilities that exist today that actually have come of age today, that allow us to do things we weren't able to do 3 to 4 years ago. So if this pandemic had hit, say, in 2015, and we wanted to create the equivalent of a digital health credential, what would we have done? We would have gone out and built some intergalactic centralized database that had everyone's information in it. It would take us 3 years to build, probably wouldn't work that well anyway. And it would be such a target for cyber attacks, right? What this allows us to do using things like blockchain, QR codes and encryption is to leave that information distributed and just create the ability to interoperate where we are not creating that central database and we're not carrying PII on our phone, and we don't have to call home every time you do a verification. So this is very important in Europe, for instance, where they're really concerned about privacy. When you scan at the edge your credential and someone verifies it, that verification happens at the edge. It does not call home to the database, centralized, the authorized issuer, to say, has Tim actually been immunized or tested? Because what that would do would leave a breadcrumb for the government to see that I got on this train or this airplane or went to this sporting venue. And that makes people really, really nervous. It's just a electronic equivalent of your paper card. Someone can look at it and say that's correct, or they can zap it with a QR reader and say it's authentic without any call home, without any sharing of information.
Jason, this is Jay. I'd like to add a couple of things to that. I agree with everything that Tim has just said, to be sure, but there are a couple of added features that we want to make sure we talk about and think about this. And one of them is equitable access to these kinds of credentials. So although it's very nice to have this kind of thing on a smartphone, and that's a great platform for it and one that we will use as well, we also want to make sure that people who don't have access to that kind of technology or can't afford it or don't have the broadband connection needed to download the material the first time still can benefit by these kinds of opportunities and credentials. And so there needs to be a platform that has capability even to use paper if necessary, but still make sure that it can't be counterfeited, because Tim's absolutely right. Not only can you create one on PowerPoint, you can download blank cards like the CDC has issued from your favorite vendor on the internet, including eBay, and fill out anything you want on it. And so can anybody else, by the way. So not only can you falsify it, but somebody can create a false one for you too, which is equally bad. So we want to make sure, absolutely agree with the components about trust, but we also want everybody to have access to this kind of credential, regardless of socioeconomic status, regardless of whether they're rural or urban, regardless of whether they have a smartphone or not. Everybody should be able to use it if they choose. And again, completely agree with Tim. It's voluntary. It's the individual's choice. They choose whether or not they want to do it. They don't have to. Thank you.
And one additional point I can add on this is, JP, is on this note of equitable access and voluntary use of these platforms. We're still in a phase of the pandemic and the vaccine rollout where not everyone who wants to be vaccinated has in fact yet had the chance to do so. There are people who aren't going to be able to be vaccinated, and those people are relying on testing to get access to many of the same services that we're hoping that vaccine credentials can begin to unlock. And so it's important that platforms also respect people's ability to prove their COVID immunity status or COVID current test result status. So many of the sort of health pass systems that are out in the market are actually sort of going beyond just simply being a vaccine credential or being just a test pass, and are encompassing both of those things. That provides some benefits in terms of choice and equity, but it also preserves some benefits in terms of privacy. There are aspects of my immunization status that I might not necessarily want to share, at least in these times. For example, being very early in receiving first and second doses of the vaccines here in the US might convey certain things about my employment or my health status that I might not want to share with someone. And so passes that take efforts to preserve that level of privacy and just say, yes, in fact, JP is in fact cleared for this particular activity can go a long way as well.
A lot of these efforts are just in the beginning stages. I read earlier that in some ways there's 20 different efforts that are ongoing across the the nation in some way to create some sort of credential or such. So let's break down like what needs to go into an effort like this. What role maybe does the federal government play as well? Can we talk through that a little bit, and then we can maybe get into the technology side? I don't know who's. I'll just open it up to the panel.
Well, sure, I'll take a shot at it. So this is Tim again, and what you're really getting at is the key point of interoperability and the ability to share information across a complex ecosystem, right? There will not be one health credential capability out there, right? I was just on with some folks over in Europe, and they have the Green Pass, but within each country is kind of developing its own capability. The federal government here in the United States has taken a hands-off approach on whether a state will develop a health credential or not. And, same thing is happening in Europe. So there's going to be different, call it credentialing applications, but all these systems need to be able to talk to each other. So when you think about it from an architectural point of view, you need to think about the application sitting on top and then the interoperability layer at the bottom, which basically sets the standard for a few things. When you think about how this works, there's the issuer, there's the resident, and then there's the verifier. And so the resident downloads a wallet of some kind, and then he requests a credential. So for instance, state of New York is the authorized issuer of a credential in New York. So I get my wallet, I ask New York, may I have a credential? I put in some minimal information. They ask me some challenge questions. We verified who you are, here's your credential, okay? So we need a standard for what constitutes an authorized issuer that's recognized on the network. So now I have a credential. Then there's the verifier, and the verifier can be a sporting venue or a restaurant, an airline, or a cruise line. Who is authorized to be a verifier on the system? How do they recognize the state of New York is an authorized issuer? So for instance, tourist season is coming up in Europe, and we're talking to Hawaii, for instance. Hawaii, great example. They want to open up their island for tourism. It's a huge part of their economy. So they're encouraging travel to the state of Hawaii starting on July 1st. They want to know when someone comes in with a credential from, say, the state of New York, how do they know that the state of New York is an authorized issuer? Or how do they know that France is an authorized issuer? Okay, so the standards, the interoperability needs to occur at that information layer. What is the standard for an authorized issuer? What constitutes an authorized issuer, that I can recognize them? What constitutes an authentic credential? There's some minimum capabilities in there, and how do I verify it? That's where the interoperability needs to occur.
This is JP, happy to chime in on this one as well. So the VCI effort that all of us here are part of has really been aimed at driving that technical interoperability layer portion of things. And so the notion has been that since our federal government was not going to be taking a position of building a registry and a single, government mandated credential, that this was something that the healthcare and health IT community needed to come together and solve on relatively short order. And so that's what we did, sort of starting very end of last year, began to gather a crowd of folks, including EMR platform vendors, some key health systems, technology providers, nonprofits and conveners like ourselves and MITRE and such, as well as folks from CDC, from ERA, the group of state registries, and lots of other folks along those lines. And the idea was, could we figure out a way to leverage the existing healthcare infrastructure, the standards that have been in place for years and are recently mandated by the federal government to help people get access to their medical records from systems and providers who have access to those records, a technology called Smart on Fire. And could we marry that with sort of the newest and best technologies for helping us gain access to all of those decentralized features that Tim was talking about earlier, so that these things can live on our phones, they can be completely portable and yet still trustworthy, no matter how we end up conveying them to verifiers on the other side of things. And so for that, we leveraged the new W3C verifiable credential format and essentially sandwich those two things together. So the underlying data payload comes from health IT infrastructure, so that hospital systems and pharmacies are really easily able to produce these data in a format that we can all share. And then we're able to package that up in a way that makes it trustworthy. And so sort of that approach, by coming together with the health IT system and leveraging best-in-class existing standards, I think gets us a long way to that technical interoperability that Tim was describing. And with that, we can have some benefits along the lines of, pharmacies or EMR vendor platforms. They're able to simply issue these credentials to anyone who would like to access them. And all of the various personal health records apps or health wallets should be able to bring these in and use them uniformly, regardless of where they came from. Apps like IBM has built for New York, the Excelsior Pass. We don't want to go and redo all the work that IBM has done in New York to get New Yorkers access to our records. But this is something that Excelsior Pass could simply output as a means for me to gain access and import into, other states' wallets, into, my United app, whatever the case may be.
So this is Jay. I just want to pile on to what JP just said and make a couple of additional points. Everything that's been said is exactly spot on. But first of all, I want to call out the importance of the private sector in all of this. You mentioned, Jason, at the outset that the US federal government has decided to play a little bit of a hands-off role for the time being and probably indefinitely on this, and that's fine. The private sector has stepped up, and that's been great. And we've seen that all along with this pandemic, with the C19 Healthcare Coalition and so forth, where the private sector has really stepped up for over a year now to try to make things happen. But in addition to that, think about this vaccine credential as another piece of your health information. And we already have throughout the industry ways of protecting everybody's health information, just as JP described, with the standards that already exist and the frameworks and the rules around that make all that information protected. So these credentials are basically an application of pre-existing standards and capabilities that existed beforehand with respect to health information. And this is another example, because your immunization status, whether or not you've been vaccinated, whether you just had a negative test, or any other piece that is necessary to help with these decisions as to whether or not you can go in and attend that concert or not, are basically pieces of health data that we know how to protect.
And what's most exciting about all of this to me is we finally found a good use for QR codes. For years, I was wondering, what are these good for? And now we figured it out. Ordering at restaurants and potentially a vaccine credential. Let's take a quick break. And when we come back, we'll continue our conversation. You're listening to the panel discussion, Coronavirus, the Need for a Vaccine Credential, sponsored by MITRE on Federal News Network.